Welcome back here on Live Now from Fox, 6:33 on the East Coast and 3:33 on the West Coast. My name is Josh Breslow, and I'm here for the next several hours to bring you all of your top stories and live events from across the country and across the world. Do want to get you over to a live look that we do have over Tallahassee, Florida right now, as this takes us to our next story. Florida planning to become the first state to eliminate all childhood vaccine mandates. The state surgeon general casting current requirements in schools and elsewhere as a, quote, immoral intrusion on people's rights. At a news conference earlier today, making the announcement, he explained it hampers the parents' ability to make health decisions for their own children.
Every last one of them is wrong and drips with disdain and slavery, okay? Who am I as a government or anyone else, or who am I as a man standing here now to tell you what you should put in your body? Who am I to tell you what your child should put in your body? I don't have that right. Your body is a gift from God. What you put into your body, is because of your relationship with your body and your God. I don't have that right. Government does not have that right. They want you to believe they have that right. And unfortunately, they've been successful. They've been successful. Pretty much every state has them. It's wrong. It's immoral. They do not have the right to tell you what you put in your body.
All right, and that was the Florida Surgeon General there. Now, the chair of the Florida chapter of the American Academy of Pediatrics saying that removing vaccines puts students and school staff at a greater risk. I do want to discuss all of this here further from a medical standpoint. So let's bring in Dr. Evan Nadler, Associate Professor of Pediatrics and Surgery at the George Washington University and founder of ProCare Telehealth. Thank you so much for taking the time to be here with us today and help break this down a little bit further.
Oh, thanks, Josh, so much for having me. It's actually a really fascinating happening. Like it's a new chapter in American public health, really.
And I did want to ask you here, from a medical standpoint, can you break down for me kind of the impacts here as we do see that vaccine mandate for children kind of removed there in the state of Florida?
Right. So from what I read, it's actually going to be not just the vaccine mandates for children, but for everyone. And there'll be different impacts, whether it's childhood vaccines or healthcare workers who also have vaccine requirements. And what it all means is that people will have a choice. Now, if people choose to continue to get vaccines at a high rate, then we probably won't see too much of a difference in terms of herd immunity, which people have talked about, and overall infection rates. But if people choose not to get vaccines, then it is certainly possible that, we saw in Texas, West Texas, that measles came about pretty quickly in some significant numbers. And obviously that could happen anywhere, including Florida.
How do these vaccines help with an outbreak of an infectious disease? I mean, there are several of them, of course, that children are vaccinated for, but how does that kind of help with the outbreak itself and preventing it?
Right. So so I alluded to herd immunity, which is basically with a disease like measles, let's say, as an example. If about 90% of people get immunized, or I can't remember the exact number, but it's a high number, 95%, then basically the virus doesn't have enough hosts around and it sort of goes away. And that's what's happened with polio. But however, if the vaccination rates are low enough, then the viruses can find hosts. And then what happens is that people who either can't get the vaccine for reasons such as they're immunocompromised or a cancer patient, something like that, then they're at risk because the group is no longer protecting them by sort of wiping the virus off the face of the earth.
And of course, there are a lot of questions there about those who are immunocompromised, maybe at higher risk. But what do you think that people, especially parents, caregivers, need to keep in mind in light of this shift in policy?
Yeah, so I think there are a couple of things. Again, on the older age range group. So if I were the child of a parent who was in a assisted care facility or a, some, like if my elderly parents were in an assisted care facility, I would be worried that the healthcare workers who work there no longer have to be immunized and thus could certainly bring one of those previously preventable diseases to that care facility and potentially infect, my parents. So I would certainly want my parents to get vaccinated. And on the other end of the spectrum, most kids get their vaccines, or at least begin their vaccines in earnest in the first couple of years of life. So even if this policy went into effect tomorrow, it would probably be 3 to 5 years before we really saw what children who aren't vaccinated mean to the overall infection rates in a school setting. But again, if you were the parent of an immunocompromised child, then that would be, again, a bigger concern and something you would have to think about when you're sending your kid off to school.
Long-term concerns and benefits of ending a vaccine mandate. What do we know from a medical standpoint?
Well, I actually think it's going to be somewhat fascinating if this actually happens the way Florida has described it, because in the sort of medium term, again, 5 to 7 years, we actually may have like a real world experiment where we see what happens if we get rid of a mandate. So the first piece will be how many people still choose to get immunized. So that'll be interesting to see, because right now it's a lot of politicians who are making these decisions. I don't know what the people on the ground want to do. And certainly what the people want to do on the ground in Florida may be different than what the people on the ground in Oregon want to do. So that'll be the first interesting piece of information. Second interesting piece of information will be, so now what happens? Again, do we see lots of widespread disease and the pendulum swings back to, oh, you know what, those vaccine mandates were actually preventing a lot of deaths and we probably should keep them? Or maybe we don't see that, and then the sort of folks who are advocating for fewer mandates will be proven right, and then other states may follow. So it's really actually, again, it's like a natural experiment that rarely happens in the world we live in.
And that was going to be my last question for you. Do you think once Florida does go through with this, they've announced it today, it was just hours ago, do you think that other states are going to say, well, maybe that's a good idea, let's try it ourselves? Or could they wait to kind of see what happens in the coming years, as you mentioned?
Yeah, so, it wasn't really until COVID that medicine as a field became politicized. And it certainly wouldn't surprise me if states who are more red in nature follow suit with Florida before the evidence is there. My guess, and I already saw that, I think Oregon, California, and I can't remember if it was New York, or if there was a third state where the 3 states are already going to come up with their own vaccine recommendations in case the CDC changes them globally. So it's going to be, I think, probably, unfortunately, a political football in the near future. And then you go again, it's like a natural experiment. So the states that keep the mandates will have one set of outcomes, and then the states that don't will have another set of outcomes. And 5 or 10 years later, we actually could have some really interesting data to review.
All right. Dr. Evan Nadler, thank you so much for taking the time to join us and provide that information there from a medical standpoint. Anything else that you want to add? Anything we missed here before I let you go?
I think the only other thing I would add is that these are still medical decisions, and I would recommend for folks, if you have a question, seek out your primary care provider or someone who you're seeing for medical care, because again, at the end of the day, it's still really a medical decision, and you want to get as much information about that decision before you make it. So please seek out some opinions before you make a decision one way or another.
All right. Dr. Nadler, thank you again for taking the time to be here. We appreciate it.
Hey, my pleasure. Anytime.